The final weeks of pregnancy can be both exciting and challenging. As your due date approaches, you may start noticing some changes in your body that indicate your baby is getting ready to arrive. During the last week, you might feel your baby dropping, which means they are settling into your pelvis. This can increase pressure in your lower abdomen. You could also experience more frequent contractions, which feel like a tightening in your belly. These are your body's way of preparing for labor. As the big day approaches, watch for early signs of labor, such as a bloody show or the loss of your mucus plug, a sudden burst of energy known as nesting, and, most importantly, regular contractions. When contractions become regular, strong, and closer together, it's time to head to the hospital. Once at the hospital, the first stage of labor begins. This includes the early phase, where the cervix starts dilating, and the active phase, where dilation progresses more rapidly. It's important to stay relaxed and follow your breathing techniques. As the cervix fully dilates to 10 centimeters, you'll enter the second stage, the pushing phase. With the support of your doctor and nurses, each push brings you closer to meet your baby. And then, the moment you've been waiting for, your baby is here. After delivery, the third stage involves delivering the placenta and ensuring you and your baby are healthy and comfortable. The moment your baby comes into your arms, all the pain fades away, turning into pure joy. As you begin breastfeeding, a deep connection forms between you and your baby. But how does your body start producing milk? And what makes it the perfect first food? Watch about breastfeeding in our next video.